Physical examination documentation is crucial for comprehensive patient care. This video will explain its importance, standard terminology, frameworks, techniques, clinical judgment, and interpretation of findings. You will gain a comprehensive understanding of its role in patient care. Physical examination documentation is crucial for comprehensive patient care as it provides a record of the patient's health status, aids in communication among healthcare providers, ensures legal and ethical standards, and contributes to research and quality improvement. Standard medical terminology ensures effective communication in physical examination documentation. It includes anatomical, physiological, and pathological terms, along with descriptors for findings. Examples are ICD and SNOMED-CT. Familiarity with these terminologies is crucial for accurate documentation. Structured frameworks, like SOAP and ICE, help healthcare professionals organize physical examination documentation. SOAP includes subjective and objective information, assessment, and plan, while ICE focuses on patient-centered communication. These frameworks ensure comprehensive, organized, and patient-centered care. In this video, you will learn a systematic approach to performing and documenting physical examinations. It starts with building rapport and obtaining consent. Throughout the examination, each body system is evaluated systematically, documenting any abnormalities. Accurate measurements and detailed descriptions of findings are essential for thorough documentation. In order to fully assess and diagnose a patient, it is important for healthcare professionals to integrate physical examination findings with the patient's history. This provides crucial context and helps interpret the findings accurately. By combining objective and subjective data, a holistic understanding of the patient's health can be obtained, leading to targeted interventions and further investigations when necessary. General inspection and documentation of physical appearance and well-being provide valuable initial information about the patient's overall health status. During general inspection, healthcare professionals observe the patient's appearance, behavior, posture, body habitus, and signs of distress or discomfort. Documentation should include details such as the patient's level of consciousness, body weight, height, and general disposition. Note any abnormalities such as deformities, asymmetry, signs of nutritional deficiencies, skin discoloration, rashes, or edema. Pay attention to the patient's hygiene, grooming, and signs of physical abuse or neglect. Deeper inspection may involve palpation of lymph nodes, assessing muscle tone, and evaluating sensory functions. Comprehensive documentation of general inspection findings helps establish a baseline for the patient's health and assists in identifying potential abnormalities or significant changes over time. In the video on physical examination documentation, accurate measurement and documentation of vital signs are discussed. Vital signs such as temperature, heart rate, blood pressure, and respiratory rate provide objective data for assessing a patient's overall health. It is important to follow standardized protocols and use appropriate equipment for accurate measurements. Precise recording of the patient's vital signs should include the measurement methodology, specific values, and any relevant contextual information. Consideration of the patient's age, gender, and underlying medical conditions is also necessary. Thorough documentation enables healthcare professionals to monitor changes, identify abnormalities, and make informed decisions. A thorough head-to-toe examination is crucial for assessing all body systems and documenting findings accurately. This examination should be systematic, starting from the head and progressing to the neck, chest, abdomen, extremities, and back. Document findings related to each body system, including the head, scalp, hair, face, eyes, nose, ears, and mouth, neck, thyroid, lymph nodes, chest, breasts, heart, lungs, abdomen, liver, spleen, kidneys, gastrointestinal organs, extremities, skin, muscles, joints, and back, spine, musculoskeletal structures. Note any abnormalities, such as masses, lesions, asymmetry, or tenderness, along with specific details such as size, location, color, and texture. Thorough documentation ensures that no significant findings are missed, allowing for accurate assessments and appropriate interventions or referrals when necessary. Assessing organ systems in physical examination documentation is important. Specific techniques are used to assess the cardiovascular, respiratory, gastrointestinal, musculoskeletal, and neurological systems. Documentation of findings helps with diagnosis and treatment. It is essential to acquire technical skills for accurate documentation in physical examination. Techniques such as percussion, palpation, auscultation, and inspection are used to evaluate body systems and document findings. These techniques involve tapping, using hands and fingers, listening with a stethoscope, and visually inspecting the body. Accurate assessment and documentation require practice and attention to detail. In the video, we discuss the importance of clinical judgment and interpretation of physical examination findings for healthcare professionals. We highlight the need to critically evaluate the significance of the findings, integrate knowledge and reasoning, and consider patient factors. These skills are essential for accurate diagnoses and improved patient outcomes. Physical examination documentation is crucial for identifying potential diagnoses, ruling in or ruling out conditions, and prioritizing diagnostic possibilities. It guides targeted investigations, monitors changes in health status, and improves patient outcomes and resource utilization. Physical examination documentation plays a crucial role in patient care, communication among healthcare professionals, legal compliance, medical research, and education. Standardized terminology and structured frameworks enhance communication and organization. A systematic approach, integration with patient history, accurate vital sign measurement, thorough examinations, technical skills, clinical judgment, and timely documentation all contribute to optimal patient care and improved health outcomes.